Hi, my name is Desiree Fuentes. I'm a student in physical therapy here at Concord Career College. I chose to do my outcome measurement project on the Timed Up and Go test. In this PowerPoint, I'm going to be discussing what the Timed Up and Go test is, who is it catered for, how is it administered, what are the methods, as well as what are we looking for with doing this Timed Up and Go test, the benefits as well as the downsides to the test. So what is the timed up and go? So the timed up and go, or more commonly known as the TUG or GUG get up and go test, is a frequently used tool that basically allows therapists to evaluate patients and essentially assess the patient's risk for falls. Um, this relatively simple and quick assessment measures mobility, balance, as well as lower extremity function. And this test is relatively simple and quick as it's just a 3-meter walk to and back to the chair. So who is this test catered to? So although it's commonly and mostly seen used in the geriatric population, it is also used in patients with Parkinson's disease or also patients post-CVA as well as much more. The reason as to why we do this test is for falls. So falls are one of the most commonly seen injuries within the geriatric population due to their very limited mobility, with age. Essentially 25% of the geriatric population states at least one fall a year. And that number doubles once they reach the age of 70 and older. And falls have become such a big public health concern, just because it results in these patients developing such a sedentary lifestyle, loss of function, as well as deteriorating the quality of life. The reason as to why falls occur, it can stem from just a variety of variables, whether that be intrinsic, extrinsic, and even behavioral variables. So the main contributing factor being muscle weakness, balance, gait issues, as well with that. Just stuff around their house, clutter, stepping wrong, just anything that is in their way can essentially be a fall risk. Now, with Parkinson's, the reason as to why there are fall risks can stem just from a variety of different factors. One of them being their postural instability. The shakiness, the stiffiness, just very slow movement. They're shuffling in their feet, the very stooped, flexed posture. And with the CVA, with the post-stroke patient, their out of fall risk is due more of a cognitive impairment. So after a stroke, it can affect, just their attention, their orientation, as well as their balance. So altering the brain, just the way that the brain alters after the stroke in controlling equilibrium can lead them to feel just a sense of weakness, unsteadiness, and sensation loss. And even with all of these, a big thing too can be just how the patient is doing mentally, or if they have that insecurity of that, oh no, like I don't want to go out because I want to fall. It can be the same thing. So how is it administered? So just how I mentioned briefly early on in the PowerPoint, this test is very simple, quick and easy, with very minimal equipment. The equipment one needs is a chair with an armrest, a stopwatch, as well as a tape to measure that 3-meter. Once again, the stopwatch can either be just a regular stopwatch, a timer, or even using your iPhone if you have the app to time. And that's basically it. So the method of this test, so the data is collected in seconds, and is administered first by the patient, beginning in a sitting position with their back against the chair. Of course, you want to make sure that the patient is wearing regular footwear. They are then instructed, well, first they're shown what they're gonna do. Then the therapist will ask them, to stand up. If the patient is coming into the clinic with an assistive device, they are more than welcome to use.
In
the
this
assistive
video, we're
device
going to be looking
to
at the
complete
time.
The tug test. So once again, they start seated, the patient stands when the therapist says go, and they essentially walk the 3 meters, turn back around, walk back into the chair and sit completely back. The time starts once the patient starts, so they start once the patient begins to move out of their chair, and it stops when the patient completely sits down in their chair.
Goes.
So although this test is relatively easy for one to perform, what is it that we as therapists are looking for? So we're looking for just a variety of different things. We're looking for the patient's postural stability, their gait, their stride length, as well as if they're swaying. As well with this, you want to document any assistive device being used, any loss of balance, if there's little to no arm swing. As well, from there, you would then further evaluate if needed. So essentially, if the patient performs the tug or the GUG test less than 10 seconds, they're considered normal. If they're doing it a little bit less than 20 seconds, they're considered good, able to go out into the community on their own, essentially with no assistive device. Whereas if a patient takes more than 30 seconds to complete the 3 meter walk test, they may need an assistive device if they're not using one at the moment. You may also want to work on gait training, as well as them needing assistance once they're out of the community. So what are the benefits of the timed up and go test? So the benefits of the tug test is that it's quick, easy, very simple to administer. Very little equipment is used, just like I mentioned. You just need a chair with an armrest, stopwatch, or a timer, or your phone if you're going to use the app, as well as tape just to measure those 3 meters. As well with this is it can be administered basically anywhere, just as long as you have those 3 meters marked. And it's also very much reliable and valid. So it's reliable and valid in the sense that it doesn't matter who is administering the test, it's always going to be consistent, it's always going to be administered and done the same way. So a patient comes in for their first time, the PT administers it, then couple sessions go and the patient comes in again and they're due for a progress note, and it says there to perform a tug test. The therapist performing it or doing the progress note is going to know exactly how to administer the tug test, and is going to go document into the patient's chart what they got, if there was a change, whether that be good, or maybe they if they progressed or if they didn't progress, and then just determine what they need to do after that. The only downside with the timed up and go test is that it's unable to predict falls in the community. So yes, this test is very well administered in the sense, because it's administered in the clinic. The patient stands up, walks 3 meters and comes back. And that's essentially good. We do have those time frames of the 10 seconds, the 20 seconds and the 30 seconds. But essentially, if the patient leaves the clinic and later on the day they go to the park, it's very uneasy pavement. If they're going to the grass or even the street with the gravel, it's very hard to basically say, oh, this patient is not a fall risk, and then the next visit they come in and they tell you that they fell because they lost sense of stability or loss of balance walking on the field or walking in the park or in the community. And that concludes my presentation on the timed up and go. Thank you.